out of there. Holy
It's 7:15 on a Sunday morning. I received an emergency call from Dr. Rachael, and I'm on my way to meet her for a colic and a horse. Early morning run.
It's early Sunday morning. I just got a call for a colic that's down here in Lakeview Terrace. How old is he?
He's 11.
Okay.
So he's 11 this year.
You've had him for 3 months. Has he had previous colic episodes in the last 3 months?
No.
Hi, Sandu. Hello. Hello. Aren't you pretty? Hi, baby. Hi. Yeah, that's a thermometer. Hi. So I'm here today to see an 11-year-old Arabian gelding who has been showing some abnormal signs to his owner. He's off his feed, not interested in his food. He's not passing manure. He's been stretching out, and he seems very uncomfortable when you touch along the outside of his abdomen. First thing we're going to do is check his heart rate, respiratory rate, and gut sounds. You're a good boy. Yes. Well, he's a pretty chestnut. Calm down. It's all right, baby. Is he shaking his head a lot like that?
I think he's
Just irritated. Stranger danger. The physical exam is the most important aspect of doing a colic evaluation, or really any evaluation. That is going to allow me to assess his level of pain by checking his heart rate, his respiratory rate. I'm going to see whether or not he has a fever. I'm going to be checking his skin turgor to see whether or not he's dehydrated. I'm going to be looking at the color of his mucous membranes, as well as whether or not it appears to be moist or tacky. And so he has been eating the bran mashes, but not eating his regular hay, because you were worried about adding to the impaction. And he does not have a complete absence of gut sounds, so that's good. His color's not bad. He's a little tacky. Are you seeing him pass any gas?
No.
Okay.
He had one big fart yesterday, and that was it. That's all we noticed.
All right, well, he's gonna get some more medication right now, okay? And I'm gonna do a rectal exam, and we're also gonna pass the tube, and I'm gonna try to make sure that we don't have to decompress the stomach, and I wanna rehydrate him and also give him some mineral oil. I got a horse that has a mild symptom chronic colic over the past 3 days. And so it's not acute, it's not ultra dramatic. He's not thrashing or throwing himself on the ground. He's not drinking like he should be. We have recent changes in the weather, so I'm seeing a lot of these. The horses just tend to not drink enough, and there's a chance this could be some kind of an impaction colic. So right now I'm drawing up an anti-inflammatory drug. It's called flunixin meglumine, commonly known as Banamine. I'm also going to use a prokinetic drug that is going to stimulate more gut movement, because they can't vomit on their own. And so if they have a blockage in their stomach, it can just continue to back up, or a blockage in their small intestine. It'll continue to back up until their stomach will just explode. But in order to pass that tube, they have to actively swallow, which is not an easy thing to get a horse to do. We're gonna get a little personal, honey. Sorry, boy. With the vet records that you got, did he have any history of colic? Okay, we're gonna see how he does. Everybody watch yourself, sometimes they like to kick. Okay, just relax. It's not gonna hurt me at all. When I did a rectal exam on him, where I actually will stick my arm all the way up the rectum in order to pull out any feces that's in the rectum, and also it will allow me to take a feel of the rest of the intestines that are within my arm's reach. I was able to notice that he had a lot of very dry fecal material, small, hard, dry balls of fecal material, which is indicating to me that he is a little bit dehydrated. He has a little mild impaction. I don't feel a giant impaction, but my arm can only go so far. Lots and lots and lots of dry poops in here. They're hard as a rock. So I can feel some more hard fecal material in his distal colon. But these fecal balls, they're very, very hard. There's a little bit of mucus covering them. You know, he hasn't been eating very much in the past few days, so it doesn't surprise me that there's not a whole lot in there, but I don't feel like a giant, sometimes I go in there and I feel a giant hard loaf. And it's like, that's the impaction, that's where it's at. One of the things that my client told me that is a little bit concerning is the fact that he was stretching out a lot. One other thing that sometimes will correlate with horses that are stretching out and have a mild colic can be an enterolith, which is a giant stone. I can't feel that. It doesn't mean it's not there. So we're going to treat him today and we're going to try to get this to pass. I'm hoping it's just a mild impaction, but if this continues, it would definitely be warranted to take him to the hospital and get abdominal x-rays. It's something that my generator is not strong enough to be able to produce in the field. The next thing I need to do is I need to pass a tube, a long tube that's going to go through his nose, down his esophagus, and into his stomach. You're not going to like this very much. What we'll do is he's going to go backwards. We'll let him kind of back into the corner over there. Hopefully he won't go up. The main thing is don't get hurt. He could potentially get a little nosebleed from this, okay? So just heads up. And when they have a nosebleed, they bleed a lot. In passing this tube, I'm going to check whether or not he has fluid accumulation and buildup in his stomach. Okay, bud. Oh. Okay, so right there at the larynx, right about here, you got a little fork in the road. You can either go down the trachea, which goes to the lungs, we don't want to go there, or you can go down the esophagus, which goes to the stomach. That's where we want to go, right? Hi, you're okay. It was terrible, but you did really, really good. The trachea, just like us, like our windpipe, it's going to have those big cartilage rings. When you go down the trachea, it's real easy. There's no drag. It's also much easier to pass into the trachea. And that's not where I want to go. I have to have them actively swallow and have it get into the esophagus. And that's a collapsible muscular structure. So when I suck on the end, which is why I put it around my mouth, if I get air, I know at the other end is lungs. And that ain't good. If I suck at negative pressure, don't get anything, I'm probably in the right spot. So that's what I was doing. The other thing I was looking for is it's going to be down the left side that the esophagus runs. And in many horses, you can actually see it as it goes down. And in his case, I could. And once I'm down in the stomach, I can blow and I can get the most nauseous smell that comes back. Thank you for that. I need to decompress the stomach. I need to see what kind of stomach contents are in there. And if it's clear and if it's pretty much empty, then I'm going to rehydrate him with water. I'm trying to create a siphon effect to see if there's anything in his stomach. Now, with a history of not eating anything, I won't be too surprised if there's not a whole lot that's coming out. He just dries a bone. Oh, baby. And everything that I'm putting in is coming out clear, so it's just, he's just dehydrated. And I'm also going to give him some mineral oil, which can coat the stomach, it can coat some of the intestinal lining. It also will just offer some pure calories because it's oil, it's fat. It will also give us a marker to be looking for when it passes. You can see it come out and you can see it all over the fecal material when it does finally pass. The mineral oil, what it will do is it will act as a marker so we know when it passes. It will also give him some calories. It's pretty much pure fat. It also will coat and soothe the intestinal lining. The water is what we use to break up the impaction, if that in fact is what he has. If he has an enterolith, a lot of times the mineral oil can help coat the edges, which will encourage the stone to move on down the road, so to speak. Right, now I'm going to take the tube out. Okay. Good boy. So sometimes that can feel a little bit weird to them because we just filled up his stomach. You don't want to over distend the stomach because number one, that can hurt. Number two, if for some reason he has it where there's a blockage in the small intestine or in the stomach and it can't continue to pass, they can't throw up, and if it can't go forward, it'll just explode. Good boy. You did really good. I know that was awful. That was awful. And we just met. You got violated from both ends. That was terrible. So my patient has done very, very well. He was given a mild sedative to help facilitate the passage of the nasogastric tube. I also gave him some anti-inflammatories and antispasmodic, as well as a prokinetic drug to help synergistically make the gut feel better and stimulate the movement so that he can start passing fecal material. So now it's sort of going to be a watch, wait, and see. We're going to see how he responds to this. He just got a bunch of water as well as mineral oil. He got some drugs that should help him out. What I would be doing is I would be probably walking him. Movement and fluids are what will break up an impaction if it's possible to break it up. So that concludes my Sunday morning excitement. The deal is this, if I have to come back, I'm gonna have to do what I just did again. I don't wanna have to do that, so you gotta bounce back. You have to start drinking and eating and pooping. You have to start passing, okay?